We are launching telemedicine at Stony Brook, and so we are evaluating multiple different technologies and creating clinical workflows to modernize the way we practice medicine. And so we have to think of policies and procedures, as well as engaging the physicians to try new technologies. And so that's kind of what I do on that side. In terms of the Deputy CMIO role, I help try to improve the doctor's relationships with technology and the electronic medical record to improve, to reduce burnout and improve their work experience. I think that the needle is already shifting. It's kind of pushing us to implement remote patient monitoring, really. So patients have an incredible amount of data that is being generated through products that are right now mostly commercially acquired, such as Fitbits or Apple Watches, but it could be their glucometers, their pulse oximeters, Bluetooth blood pressure cuffs, and that data is not successfully and optimally shared with their providers necessarily, in being able to inform clinical decisions made in real time. So the idea of remote patient monitoring is figuring out how do you integrate that data and to improve health outcomes and help patients take ownership of their clinical data while also involving their care team in making joint decisions. Yeah. Interoperability is the future. Right now, a lot of data, it is the patient's right to access their data, and that can sometimes be made difficult if there are multiple different healthcare systems involved in a patient's care. So what interoperability does is it democratizes the data and being able to have the patient access their information regardless of where they decide to seek care. And there are big initiatives such as the regional health information organizations that are working to be a central repository of that very valuable data. So interoperability offers the promise that patients will be able to go to seek care wherever they want to and be able to have access to their data whenever. This is just my personal view, that I think that patients are probably less fearful of what happens to the data than health systems themselves, who are accountable and regulated on their ability to handle such sensitive information. I think that we have new initiatives like Apple Health Records that are offering patients to access their data more easily on their mobile devices. And there are other technologies that allow patients to share things openly. And I think you can look at the internet and learn that patients can opt to, open source or crowd share their data because they're looking for answers. So I think that it's a very important discussion. I think we have to do more in terms of patient education to understand the monetary value of healthcare data and how it can be used in dark ways, such as in creating fraudulent clinical encounters or being linked to financial information. These are not, it's not fear-mongering. It's really education to patients to understand why healthcare data is more expensive to protect than any other kind of data because of the potential for fraud and abuse. That being said, we should all be looking at how to optimize data to improve patient outcomes. And as a healthcare system, it's more important that we help not only shepherd the patient through understanding the importance of privacy in healthcare data, but vetting vendors and other third parties to know how they're going to be using the data if we are going to help them get it. The patient is at the center of all of these changes in healthcare. The idea that the patient will have access to their own data, the patient will be at the center of the care plan. These are all important things. How we engage the patient is the most important piece, I think, of this equation, particularly for chronic care management. There's a lot of investment being made in helping people motivate behavior change, helping them reach like smoking cessation goals or get cancer screening. And there's a secret sauce to be able to get people to be excited about engaging in their healthcare. And it's very important that we do that in a personalized and culturally sensitive way. So I think patient advocacy is the future of a successful implementation of technology in healthcare and the future of healthcare altogether.